So we are actually missing quite a few people, but so I'll give them a couple minutes, but I do want to respect all of your time. So maybe we can just, while we're waiting to see if anyone's having technical difficulties, did anyone have any other issues? Like Evans mentioned the slides, which is really helpful for me. Did anyone have trouble? I know I got at least one message from someone who wasn't sure where to find the assignments, but I think everyone in here was clear on that.
Yes,
Yes.
I had no problem.
Okay, great.
Me too.
And Fatima shared hers on the forum, which is great. I'm guessing that the rest of you brought them today, which is also great. There's no, we can discuss it as a group. We hadn't talked specifically last time about where to put the assignment, but both ways are great. That means I got a chance to have a sneak peek of hers, which was lovely.
Thank you.
Everybody was able to log in to ISIP and to the network and everything, no problems?
Yeah, I had no problem.
Okay.
No problems.
Great, yay. I mean, using the forum in this manner is not just new for you guys and for me, but in general, it's a new way of using it as a course, sort of like a learning management system, if you're familiar. Blackboard, Canvas, I don't know what is being used other places, but so we're the guinea pigs. So so any feedback is welcome, and we're trying to keep improving it. Oh, I see Veronica has joined us. So we're getting there. Hi, Veronica.
Good afternoon.
Hello, how are you?
I'm fine, are you?
Good, thank you. When you come in, you will be muted, just so everyone knows, just in case there's anything interesting, any parties going on in your home before you come in. And then at certain times, if I'm talking for a while, you can mute yourself or not. We want it to be very interactive, but if there's background noise, if you don't mind muting yourself, or you may all of a sudden start talking and realize that I've muted you because I've gotten to a point where I'm used to, if there's noise in the background, I just kind of mute while I'm talking. I personally was on a call with the State Department yesterday. I was upstairs, and downstairs my 8-year-old was screaming about a video game. So needless to say, I made sure that I was on mute while other people were sharing. But we understand it happens. So as long as we're being respectful and just doing what we can to make it a good experience for everyone, I think we'll be fine. Okay, well, unfortunately, we're missing a few people, but like I said, I'm really big on respecting people's time, so we're going to get started, and we can welcome them as they join us. Okay. So as I said, I want to make sure that everyone is really comfortable with letting me know if you have any questions, concerns, problems. I got a couple emails during the weeks between sessions, and that was great. Don't ever feel like any question is too small or it's a problem. That's what I'm here for. And also, like I said, we want feedback. So if you're like, this was a little confusing or unclear, or I wasn't really sure what to do, or when we start talking about it today, if you're like, oh, that's not what I thought we were supposed to do, all of that feedback is not just not just welcomed, but really appreciated, because we want to make this the best possible course. And that's why we didn't pick people who this is brand new for them. You guys have all been doing this for some time. You can be trainers in the future if that's something that you want to do. So we want people who have the sort of the expert eyes that you all have. So let's put it this way. I won't take it personally, okay? I promise. So.
That is a positive regard.
If I look like I've been crying, it's okay. I swear.
That's reassuring. So it's good to know.
No, but really, I feel like we're in this together, and we wanted to pick, very intentionally picked an expert group like yourselves. I think most of you know, we had a large group of people who asked to be in this course, and you guys were the ones who were picked for it. So it's there is a responsibility, I guess, that I'll place on you guys to give me and the forum and the manual feedback so that we know that this will be a great product as we go forward. So you all can learn from it, and I know I can learn from you. So that's our goal. Welcome. We have a few people who joined us late. Thank you. We're so glad you're here, and that let me know if you had any technical difficulties or anything. So we're going to jump in now to our first competency and our first skill. It's really exciting. I think I mentioned to you guys when we met a couple weeks ago that, I've been working on this for probably 2 years, I think. And so it's really, so it's really nice to actually be doing it and not just have it be in theoretical anymore. So thank you. So the way it's set up, as you may have seen by now, is that there's a large competency and then we break it down into the skills. And that's so that we can really practice the skills. So we've already had some good feedback this morning, a good discussion about sometimes we're doing these things and we don't even know. Maybe we're really naturally good at it. And maybe there's other things that we're not as much. And the great thing is, if you have a natural ability, like you're already naturally empathetic, and then you learn, oh, this is empathy. Oh, this is how you can strengthen empathy. That's just makes us better. But also, if you want to train, which most of you are natural teachers and trainers, when you kind of have a name for it and you know how to break it down as a skill, you can do even better to impart that with other people. So, it's nice because I think at some point in my career, I realized like, oh yeah, I'm naturally empathetic, but it's a skill that you can improve and build upon and impart and help other people with. It's not you're empathetic or you're not, right? It's not a yes, no binary thing. So that being said, the competency is effective counseling techniques for clients in substance abuse treatment. So that's obviously our large heading. And then we're working on identifying personal strengths, which we all have, things we can work on or weaknesses as an addiction counselor, and developing therapeutic relationships with clients in substance abuse treatment. So we are diving right in, right off the bat, talking about us, right? And I know that can be challenging, and I've had some feedback about that already. And I really honor all of you that you're willing to do that hard work with me. So one thing I would ask is when in the didactic piece, there is a talk about how we used to think in addiction treatment and in the substance abuse field, substance use disorder field, that, well, this person isn't ready, that they need to come back into treatment when they're ready, right? Was anyone kind of raised in a field that was the language, or that was how you were trained?
Absolutely.
Yeah. So here's a trickier question. Is it still like that in some ways?
Here in Mexico, yeah, I think 90% of professionals of mental health think that way about substance use disorders. Yeah.
Thank you.
In Nigeria, the thinking has traditionally been that if you are using substance, you should just come for treatment, whether you are ready or you are not ready.
Okay.
But for some years now, we've been maybe like a transition. A lot more people are feeling that, okay, you need to be ready before you come into treatment. So currently we have like two schools of thoughts. Some clinicians believe that, okay, look, you need to be ready. You need to be at the stage of contemplation before you come in for treatment. Some other clinicians believe that, look, even if you are not ready, once you are forced into treatment, along the way, you may be motivated to want to complete the treatment.
Right.
So currently we have two groups of people, two schools of thoughts in Nigeria. Those that believe that you can be forced into treatment and along the way you become motivated. And those that believe that, okay, you need to be ready before you even start treatment.
Okay. Thank you. I think that is a really perfect summary, probably for a lot of what we've experienced. I know I look like I'm in my 20s, but I've been doing this for a while, and I've seen where it goes from, that's not a joke. Why are you laughing? And I've seen where when I started, it was confrontational. You know, if people aren't ready to change, they're not going to change. You come back when you're ready. And, you know, we've learned over time, thankfully, 'cause I can tell you, at least from my gut and my heart, that didn't feel okay for me.
Yeah.
You know, I mean, and thankfully we've learned more, like with the stages of change and with motivational enhancement and these different theories and evidence-based practice that have shown that, you know, change in general, even take the substance use disorder piece out of it, which we know is so difficult to change in general is not linear. It's not today I decide, you know what, I want to lose weight, and then every day I just do better until I've lost all the weight I want to, right? That's not how it works. So that's why this topic of counseling characteristics and style is so important, because if we believe that we have a responsibility if we come in contact with someone who needs treatment, if we believe that we have a part of it, then we need to have these traits, you know? So I'll give you an example. I'm not a big fan of the dentist. If I go into the dentist office and they're super welcoming and they're, you know, oh, we're so glad that you're here. How are the kids doing? What's new, etc. It's going to be very different than if I walk in and they're like, sit down, it's going to be a 20-minute wait, you know, and then say the wait is longer than I expected, or say that it's more expensive than I thought, or they're rude. I don't need a really big reason to leave. I already don't want to be there, right? So that's how I look at it with our folks coming into treatment at whatever level, is that if we're kind of act like they're just another client, just another patient, it's just another day, and we don't empathize and we don't show them that we care about them, even if they did sort of want to be there, we can easily turn them off, right? Because it's you know, most people don't quote unquote want to be in treatment. That's not really where they hoped they would end up. So it's really, that's why my heart, you know, I feel very strongly about this topic. And I'm sure that most of us have a lot of these skills naturally, but then have other ones where we're like, well, we could probably work on that. I could do better with it. And so that's something that, you know, I'm excited we'll get to practice together. Did you feel when you were looking at these characteristics that we picked out, the warmth and empathy, genuineness, positive regard and respect, and immediacy, was there anything that stood out to you as being missing? Or did you feel like that pretty much covered?
I think that this premier cover of the core of the competency for a counselor.
Okay.
So that's really.
Thank you. I mean, obviously, you know, there's a lot of other things we can talk about as we go. Shigeo, did you have a comment?
I think, I don't know if that will be an skill, but I know many people that is very genuine, warm, but they don't have a clear idea of what is an addiction. So they're very confrontative. They maybe make jokes about that or something like that.
Yeah.
And that's, I don't know, when you explain them the neurobiological basis of addiction and all of that, they change immediately. So they have the skills, but they need just a little bit of comprehension. How is it? Comprehension of the topic.
Yep.
Yeah.
Yeah, that's such a great point. I mean, I guess there's almost an assumption in the manual when we talk about these skills that the person would have that background, but maybe that's not fair to say. So I appreciate that. That may need to be something that we add, that we're talking about a person who has a basic level of neurobiology and addiction, and I guess really in a way, Shigeo, you can tell me if you agree or if this is in line, who believes that it's a disease.
many, well, here, at least here in Mexico, many of mental health professionals doesn't have that clear topic. They just don't know how to connect the idea of addiction and the kind of behavior it takes. So, yeah, in my experience, when I teach these kind of minimum topics of neurobiological basis,
Yeah.
it's perfect then. Yeah.
Yeah. Great. Thank you. That's really helpful feedback.
To add to that, like here, if a person has a substance abuse problem, he's more likely to go to a religious house for intervention than to come to the hospital.
Sure.
The family members are more likely to take him to see a spiritualist or to whether Muslims or Christians or traditional. They are more likely to go there than to come to the hospital. And that is because the basic belief is that there must be a spiritual reason why this person is using substance. And that may explain why they are more likely to go to spiritual houses than come to the hospital. So we have a lot of that problem. And when it even comes to, and because of that, you see a lot of spiritual houses setting up rehabilitation centers without really understanding the basic neurobiology of rehabilitation. So right now you have a lot of religious houses setting up massive rehabilitation centers and without really having professionals work inside these rehabilitation centers.
Right. Right. Okay. Excellent. Thank you. I really appreciate that feedback. So before we jump into your preparation and on-site practice, did it make sense to everyone what the requests or what the asks of the assignments were? So first we had Maria. You were reading about Maria and answering some questions, right? And then you had some questions to kind of reflect for yourself as a counselor or as a clinician. Did those both make sense to everyone? Any questions on it before we dive in?
I have a comment.
Yes, thank you.
It was I tell you in an email, it was a really, really interesting job because it is like an introspective work.
Right.
It's like jump inside my practice and well, I discovered a lot of things, but about the manual and the skills, I think that sometimes in practice, skills overlaps. I think that
Oh, yes.
Yeah, and it was a little difficult to me to say to identify when I was being empathetic and respect, and I have respect to Alice, for example, and because I thought yeah, but I have the same behavior. I don't know how to say it, no, but I do the same thing, or probably I say the same words for different skills. That's why I think that practice skills overlaps, or are they all together in the same way sometimes?
Oh yeah, no, I think that's really great feedback, and I see some of your colleagues here agreeing and nodding. They're difficult to pull apart, and that's completely okay. You're right on track with that. What's important is to see if any of them, like I look at it from, are there any of them that I need work on? And so if probably the ones you do well on overlap a lot, but if there's something you need to work on, you could probably see that more clearly. Like for me, I'll use my children as an example. I'm really good at empathy, but sometimes I'm not good at immediacy because they want my attention a lot, right? And so like my 8-year-old will be telling me about a video game, and if he's upset about something, I'm good at having empathy for him. But if he wants to talk to me for 20 minutes about the details of his video game, I'm probably not that great about that.
Yeah.
So,
Absolutely.
yeah. But
Karen, I have the same situation than Julia. I was very confused because we have no overlap between empathy and immediacy. I said this
Yeah.
question is going to empathy, but also is appropriate for immediacy. So I was maybe I had to learn more how to differentiate this question, if it belong to immediacy or belong to empathy.
And I'm not sure that that's what's important about it, to be honest with you. I don't know that being able to say, oh, is this empathy or is this immediacy is the most important thing. I think knowing that you're doing those parts, you know, but what's helpful to me from a training perspective is I can put into the assignment for the future, for example, these will overlap. These may look the same in some examples or something like that, that will help people to not feel like they have to spend too much time trying to tease them apart. Because, you know, your client's not going to say, wow, you were really great at genuineness, but you could have done a little better at immediacy, right? That's not the conversation. They might say, I don't feel like you're paying enough attention. I don't feel like you really care about what I'm saying, something like that, right? You know, like my children are always going to tell you that they feel heard when they're upset, but like if they talk to me about a video game, they will tell you, like, I'll ask them a question. They're like, I already told you that, Mom. Well, yeah, I wasn't paying attention.
I mean, Carrie, just to jump in on that.
Please.
I do agree with you, and I want to look at it in this way, that the skills are interrelated. It's difficult to do one without the other.
Right.
A good example is for you to be understood, for you to respect and unconditionally have positive regard, you need empathy.
Yeah.
If you don't understand what people go through, you will not unconditionally accept them.
No.
So the skills fit into each other. That's how I would look at it, and I agree with you. For you to do one, you actually need to do all.
To do all. It's true.
Yeah.
And hello, Carrie.
Fatima?
Yes.
Please.
I was thinking that, you know, when I was doing the assignment, I tried to look at each of the skills and put in what I think should happen. But at the end, I was looking at a scenario where I would just combine all the skills and write a summary of what I would have done to Maria, you know. But because the assignment said, what are you going to do in genuineness? What are you going to do in empathy? I said, okay, let me break it down. But really in real life, it would have been better to combine all these skills together and put it out to the client.
Yeah. But I will say that I do think there's value in trying to separate them out, which Fatima, you did a great job. I read your work. Because there is value in seeing each of those parts and knowing what they are. So even if a lot of your examples were the same, that's completely okay. But I do think there's value in knowing them, especially if you're going to teach them, right? So we can kind of know and be good at something and know that, you know, well, the empathy and the positive regard go closely together, or the genuineness and the intimacy, you know, immediacy. But especially if you're going to teach someone, you know, if Jackie's now going to take this and go teach it to people, she's going to want to know how to kind of pull it apart and an example for each. Even though they may overlap, there still are some differences, right? So why don't we go into the assignment? That's excellent discussion. I really appreciate you all. So let's talk about Maria. Does anyone have the assignment up where they can read to us about Maria? If not, I can do it. But you might get tired of hearing from me all the time.
About the notes that we make from the questions?
Actually, could you read a little bit about Maria first? Do you have the...
Okay, well, I can do it, but I don't think my pronunciation is that clear, so
I think we all enjoy
I
hearing.
can do it too.
okay. Well, I'll try, okay? I mean, do I need to read everything of Maria case?
Why don't
Okay.
you read the first paragraph for us?
Okay. Maria is a 34-year-old female who lives with her boyfriend in an apartment in a poor area of town. She admits to having problems with cocaine over the past 3 years and to using marijuana and alcohol. Maria has three prior arrests of drug possession, stealing, and prostitution. She is currently in detention and is being considered to a treatment program after she is released. Maria completed a 4 months of substance use treatment in the past year, but she is now reluctant to go to treatment due to fears that she will lose her apartment and her boyfriend.
Thank you. Okay, someone willing to read the second paragraph for us?
I can do it.
Yeah, I can read that one.
Okay.
Oh, Jackie, go for it.
Okay.
All right. So, from Maria has a secondary degree there.
Yes, perfect.
Okay. Yeah. So Maria has a secondary school degree, but has been unemployed for the past year after she had her wrist in an accident. She has not been looking for work during the past year. She received some housing benefits in the past, but these have been cut off in the past 6 months. Maria is now financially dependent on her boyfriend's income from the part-time jobs. Maria's parents now have custody of her 9-year-old daughter due to her prior drug arrests and living conditions that have been judged by the Human Services Agency to be unsuitable for a child. The child's father is currently in prison. Maria's relationship with her parents is currently strained as the parents are reluctant to let the child return to Maria's apartment because of Maria's unstable relationship with her boyfriend. Her drug use, because of Maria's unstable relationship with her boyfriend, her drug use, and the living conditions in the apartment. The parents have also restricted Maria's visits with her daughter in their home. In your meeting with Maria, she's very upset that her parents won't let her see her daughter more often. She states, "I am so angry. My parents are always judging me."
Okay, thank you so much. Okay, so you were to make notes and indicate your how you would respond. So what you would say, what kind of body language you might do, what kind of eye contact, things like that. Starting with, and again, we're going to go through the questions, but know that there will be some overlap and some repetitive, and that's okay. Because remember, we're trying to dive deeper. And so, you know, we learned about all of this in UTC, but now we're going into a deeper level where we're practicing skills. So how would you demonstrate genuineness with Maria?
I can read my...
Please, oh yeah, yes.
Okay. How would you demonstrate genuineness with Maria? I've always think that we can all intuit in some way when someone is not being genuine. There are gestures, looks, tone of voice, body postures that communicate much more than words. That's why I think that a counselor should always be aware of the different way of communicating. To be truly genuine with Maria, I believe that it is essential to understand and welcome Maria as a human being, as a person from an ethical perspective, as a person whose dignity and value is equal to mine or that of any other human being, regardless of the life that I have had to live or the decisions that Maria in this case had made. I think a core concept is an unconditional acceptance. Sorry. In this case, I think I could demonstrate genuineness with Maria, connecting with her pain. She's going through a bad time, very fragile and anguished. I would say to Maria that I understand her anger, that I should not be easy to be to her, no, to be away from her daughter and not to be able to visit her. I would tell her that I also understand how difficult it must be for her and not to be able to work as before she does, no, she did. When speaking, I would look Maria in the eye and consciously feel every word I say. I will try to be aware of how my body claims to be genuine, like putting my hands over the desk, using language without technicalities, words, simple words. I could act spontaneously, even sharing some personal experience with Maria, if that were relevant as a self-disclosure exercise. I think sharing some personal experience or feeling or thought is a way to demonstrate honesty without mask. I will say to Maria, we all go through difficult situations in life, and what you have experiences must be especially difficult. I really appreciate the trust you place in me to tell me what you feel.
So that was excellent. So let's Veronica knows where I'm going with this. She's grinning at me. So that's exactly what we all want, right? What Julia just explained is exactly how we want to be. But what about when you have 15 clients, there's people down the hall, there's, you have emails, you have all these things, and they're telling you things. Don't we sometimes like, right? We're on the email, or we have papers, or how do we get ourselves in that mind frame to really be right there and be genuine with the person? Maybe our heart, that's what we want, but we're dealing with all these other things, right? So you're completely right, of course. But I just want to dive into how do we make sure that how do we put ourselves, maybe the better way to say it is, how do we put ourselves in a frame of mind to do what you're saying?
Okay, can I?
Omeza, yes, please.
Yeah, so I find it mostly when I'm interacting with clients, I find it very helpful. I don't take down notes. I close the folder I deliberately put the folder one side. Then my phone is always on silence. So this is to tell the client that, okay, look, you have all my attention. So I don't take down notes while we are talking. I put it, I try as much as possible to recollect everything we've said. So I don't write anything down. I put it and we talk, and I'm always trying to make eye contact with the client. And in certain situations, especially if you are meeting a client for the first time, where you've not established any therapeutic relationship, even the sitting arrangement too, you have to be careful. So usually you want to put them in such a position that they can avoid looking at you if they want to. So they are usually at a right angle to you. So it allows them the freedom to look away if they want to, or look at you if they want to. Then I have a very busy office. My office is, they call it the marketplace in the hospital because people are always coming in and going out. So, but while I'm with a client, I try as much as possible to restrict people coming in and going out, because it's really very disrupting when you are talking to somebody and they need your attention. So it's really disruptive. So I do all this, and it tends to work.
Those are great suggestions. Thank you. Veronica, you want to speak? Please. And then Fatima's next after.
All right. I think sometimes when you have this kind of issue of genuineness, and you have so many people around you, there are patients there, there are clients there, there are a lot of people lining up, sometimes it can be very, very taxing. The first thing I think I do as a counselor is that I first of all use the skill known as personal ability to check and be self-aware. What mood am I in at this particular point in time? What is the state of my psychological health?
Yes.
My affects? Does it really reflect genuineness? Because sometimes you can think that you are genuine, but your affect does not really reflect that. So I check myself, I'm self-aware, and so as to be able to convey directly what I want to convey to my clients and not convey otherwise messages to my clients. I think that is what I use, and it has always worked effectively. Thank you.
Yes.
Thank you. I really like that idea of not of making sure we're not conveying something other than what we intend. That's a really good way to put it. Thank you. Fatima?
Yes, like Veronica said, you know, when showing genuineness, your body language should be the same with the message you are conveying to the client. So, like she said also, my office is a busy office, but when I have a client and I want to show real genuineness, I'm going to lay everybody off. Immediately I have a client, nobody comes into my office. Because I think to be able to listen attentively to the client is one thing that the client cherished. The client wants to know that you are listening, you are giving him all the attention, you are attending to him. So when people comes into my office and I have a client, I'll send them out. I am busy now, nobody comes in. So that I'll be fully attentive to the client.
Yeah, excellent. I don't know how to pronounce your name. Tito?
Yes, hello, Fatima. Also, I have an office. We have a regulation in the United States very clear. It's a privacy. When I have a client, nobody is supposed to come to my office. If they come to my office, my door is closed, basically. So they know that we are in counseling session, so nobody invited me, just they back. Backing with Maria, how to demonstrate Maria genuineness. Maybe I use a lot of self-disclosure, maybe some experience with another client. I just mentioned the fact, and maybe I can start with Maria asking or let her know that I am feeling that she's expressing how she really feels about her current situation. Body language, maybe eye contact is very important. Sometimes, depending on the client, I work with cultural elements a lot. So maybe I touch her shoulder to confirm her. I think disclosure is my main skill that I use for genuineness. Disclosure feelings, disclosure agree with the feeling, normalize feelings. If I feel comfortable to sharing with the client my thoughts or my feelings.
Thank you. So I have a couple people who want to share, and I want to make sure everyone gets a chance, but let me come back to you just because we have a few other parts, and so I know you have excellent things to share as we go. So one thing that was mentioned, I think maybe Omeza mentioned about writing or taking notes when you're talking to your client. I'm gonna say something that you may not all agree with, and I'd like your input, but here's something that I think. I was completely against typing or taking notes when I was talking to my client at one point in my career. But I've considered that there are ways and times that you can do that, I feel, because as a manager, as a director, I saw the pressures on my counselors and how difficult it was to try to have a session and then also do their notes and their everything. So I think there are times and ways to do it. Obviously everybody's going to be different and decide how to do it, but I feel that I can say to you, is it okay if I'm taking notes while we're talking? That's one way to show you that I'm not just going to do it. I'm going to ask your permission. You know, it really helps me because I want to make sure that next time we talk, I have a good record of everything we've discussed. I'm still giving you my attention. I'm still looking at you, right? Sometimes I say something like, I'm sorry, I have to ask you so many questions on this form. You know, it sort of like breaks down something between us, like, yeah, this is my job, you know, they asked me to fill out these forms while we're talking, but I'm listening, you know, so I do think, I just don't want us to put an unreasonable expectation on ourselves when we have so many clients and so many things happening. So I just put that out, that I do think there's a way to do it. And as was mentioned, like how you set up your office is going to be important, because obviously, like if I was trying to teach this course to you guys and I was typing like this, that wouldn't work, right? But if I can be looking at you, like I'm taking notes while we're talking, because what you're saying is really important, and I want to change the course if I need to in the future. So I do think there's times. Now, the first time or when they're upset like this, maybe not. Another thing that I want to bring up is part of genuineness is we have to check ourselves and say, do I really think people can change? Do I truly in my heart believe that people can change? Because if you're sitting across from someone and you don't believe that they can change, you may not be thinking to yourself, they're never going to change. Because we're not necessarily like that, right? But if there's a part of you that thinks, nope, this one's never going to change, then maybe you need some extra support. Maybe you need, maybe they need to be with a different counselor. Maybe you need supervision. I mean, that happens in our career, that we stop believing that people can change, or a certain client triggers us, right? A certain client just, we're like, no, this client's not going to be able to change. I think, Fatima, you mentioned something in your writing, which was great, about that there were certain traits in a person that maybe you're thinking, you know, I'm not so sure, but our clients can feel that, right? And so if I am working with God love and I'm like teaching, but I'm like, I'm teaching, but I'm kind of like, not really, my heart's not in it. He's going to know that. And, you know, so I think we have to keep that in mind as part of genuineness. It's so important. We may have all the skills, but if our heart is thinking at that moment, oh, this person's not going to change, in some way, they'll feel that. So there's things we have to do. And then the last thing I want to say about that before we move on, because I want to make sure everybody gets time to share and we talk about all of it, is Ulia, when you mentioned saying I understand, I think that that's a little bit of a landmine. I think we have to be careful. Sometimes it can be, if you know your client and you can say to them, I understand your anger about this or whatever it is, that can go over well. Sometimes it can be a thing for them to say, you don't understand. How do you understand? Have you been through this? So I think we have to be careful. We have to remember that empathy is sometimes just kind of showing that understanding, but not necessarily saying, like, I use my kids as examples a lot. My oldest, I can say, I understand, and he'll be like, thanks, Mom. My youngest, I can tell him I understand. You don't understand. You've never had this happen to you, you know. So knowing your client's personalities, I think, is important, and knowing that, like, I don't understand everything my clients have been through. I really don't. I have total empathy for feeling anger, feeling devastated, feeling loss, feeling sadness, but that doesn't mean I understand what it's like to be addicted to a substance, be on the street, lose my child. You know, I can say, I can say, oh, it's almost better in some ways to say, I can't even imagine what that feels like. That's almost a stronger form of empathy than saying I understand at times. So anyways, I just put that out there because I don't want you to, you know, we've all had the client, I'm sure, who, you don't understand. So, okay. We're going to move on to immediacy, if we're okay with that. The great thing about this group is I feel like we could probably chat all day. You guys all have great ideas and are great participators, which is an excellent issue to have. I have no complaints about that. I've been on plenty of, I've taught plenty of classes and been on plenty of Zooms where nobody was saying anything. So you may have to, we'll be all jockeying to get a chance to talk, but I want to make sure everyone does. So, so next, how for Maria, or even if you just want to say in general with your clients, how would you demonstrate immediacy? And again, I know you have amazing theoretical answers, but keep in mind, like, the realities of what it's like working in the places that you work. So I can say all the right things of what I want to do for immediacy, but like, the fact is, you may have 10 emails, you may have someone knocking on the door. So how do you get really present with that person? Who would like to share? See if I can get different. Oh, Dr. Goodlove, please share with us. I will unmute you. Oh, did you unmute yourself?
Thank you, Kerry.
Okay, go for it. Yes.
In the area of immediacy, I will stay with Marie's presenting problem and suspend my judgment. And it doesn't matter what theoretical world, what my experience have been. Here's a human being with her issues, and I need to grasp her private world to truly understand what she's going through and suspend my judgment. When I look through that, that is the way I would do, and that's what I do with my clients in Cameroon. I try to stay with the here and now issues that my clients have brought. One of our brother talked about the religious attitude of Africans. It goes along with judgmental attitude as well. And during my recent training with where I was with ICAP 1, when I got to understand that addiction is also is a disease, it was consoling to know that it's a disease. And so you don't ask somebody how he got malaria, you don't ask somebody how he got headache. Even right now, as I talk to you, I'm just recovering from typhoid. You don't ask how, was it water? But the issue is that here I am with my issue. Please listen to me. And so I have forced myself to think that way. And I'm sensing that the more I do that, the more I'm immediate, the more I practice immediacy in the ways that I didn't know before. So this assignment has pushed me this week to truly know what immediacy really is all about. And I came to understand that in the fresh new way than before. Thank you.
That's great. And I'm glad that you're doing well and able to join us today. And
yeah, thank you.
Yeah, and you're right. And I think one thing that I'll speak when I was a new counselor, I kept thinking, like, how do I get them towards our treatment plan goals, right? Like, how to, instead of what they want to talk about in that moment. And that's part of the way that we lose people, right? We're like, well, but you're here because of your cocaine use, not because your parents are judging you. So we need to talk about that, but that's, like you said, if we're present with, Maria is actually engaging with us. Let's take advantage of that. Let's, we want to really, she's here, she's telling us what's going on. So many of our clients don't, right? They don't show up, or they don't tell us what's going on, or they just are resistant. So this is an opportunity. And if we can see it as an opportunity rather than, okay, but she's not focusing on what she's supposed to be.
Yeah.
Yeah. Great. Evans, did you want to say something?
Yes. I would taking the scenario you have given, which is the scenario we experience all the time. Many people needing services, emails, and all that. I think I would go ahead and just tell her that there's a lot of distraction around. I guess it covers both the genuineness part, but also addresses the issues that may be interfering with the relationship. Just outright telling her that there's so much around. I feel I'm not listening to what you're saying. So give me 1 second. Let's move into this private space. Let's sit down. But secondly, I would also address what she could be thinking that I'm thinking, to address any transference issues that may be there.
Oh.
I mean, she has given a litany of negative things that she has done.
Sure.
I would actually assure her that one, I would treat her differently, but I would tell her that you must think that you have done so much that even I cannot help you. Then to assure her that may not be the case.
Yeah.
Yes.
Yeah, I really like that. And you know, one of the things I really love about that is that I think sometimes we almost think that our counseling skills are like there's some kind of magic, rather than just directly saying to people, you know, hey, I want you to know that I'm really genuine. I want you to know that I'm not judging you for what you're telling me. You know, so I like how you said it, like, you might think that, you know, so much has happened in your life or so many bad things that even, you know, and you could even kind of make some humor about it if you had that kind of relationship, you know, or if you felt comfortable, like, you know, that even I couldn't help you, you know, but so I really love that. Thank you. Figueroa,
Sorry,
did you want to say something?
I think Fatima wants to take the word.
Thank you.
So
Go ahead,
you see,
Fatima.
in showing immediacy, I want to feel what the client is not talking about. You know, like Maria said, she is angry because our parents won't allow her to see her child, her daughter, you know. And in saying such thing, she may be crying internally. She may be, you know, she may be anxious. Some other things may have happened, you know. I want to know these things that is causing problem for her. So in showing immediacy, I want to really know those things that the client is not talking about, that are of great importance to her. I want to know those things that makes her happy, and those things that can make her sad also.
I think that's a great point, especially when we're talking about anger, because remember, anger is actually a secondary emotion. So when our clients, when anybody is angry, in my experience, I tend to say, you know, like in this case, I would say maybe something like, you're telling me you're angry, I understand, but you know, in your situation, I would be really scared. That sounds really scary that, you know, your parents aren't letting you see your kids enough, or, you know, something like that. Because remember, under anger is fear and hurt, you know, fear and pain. So, and sometimes a lot, like Fatima, like you said, there's really those tears underneath, but it's a lot easier to act strong and angry. And so if I say to Maria, you know, that seems really scary, or I would feel really scared in that situation, that may allow her to open and be vulnerable about that. Omeza, did you want to share something?
Yes, I think this is very important because I don't know about other places, but in my own environment, when you see a client in front of you for substance use disorder, the client is not there because of the substance use disorder. Most times when you see clients coming and you start talking about substance use disorder, you lose them, because these are people that have been using these substances for a long time, and they are now appearing before you. They are not coming because they are using substance. They are coming because something has happened. There's a new problem that has developed. There is a new complication that has come in. So if you start talking to them and say, okay, you are using substance, you lose them completely. Using this example in our case of Maria, her problem is not because she's using cocaine, marijuana, and alcohol. No. Her problem is because she's currently in detention. She has this fear of losing her boyfriend and her apartment. She is unemployed and financially dependent on the boyfriend. And her daughter is currently with her parents, who are restricting her access to the daughter. So these are her problems. So if you start by talking about, okay, you are using cocaine, you are using marijuana, you lose her completely. But if you open the discussion and say, okay, oh, I understand your daughter is with your parents, how does that make you feel? You pick her, you get her attention, and you know, you can start with that, and you get her to go along with you. So it's the same thing too where I practice. I can say 99% of the clients that come in, they don't come because they are using substance. They come because either maybe they've been arrested, or they've developed some complication, either medical or psychological complications, or they fought with their parents or something, not because
Yep.
they are using substance.
So with that said, I'm going to move past immediacy because that was perfect. And that summarizes exactly, what we need to say. So we're going to talk about next, how would you demonstrate warmth and empathy with Maria? And again, we know that some of this is going to overlap, so that's okay. Don't feel that, well, I'm saying something that's already been said, because it's necessary. Izzy, did you want to say something? If you raise your hand or unmute yourself, then I assume you want to say something. Go ahead, Shigeo.
Okay, so I write that many components of the skills are shared with similar actions, both direct and indirect communication. All of these result of internal beliefs, values, and prior experiences of our professional and personal lives. I'll try to have little things that makes some difference, like things like having a clean and tidy room to make the consultation. I'll try to say hi, to call her by her name. And I think that just the movement of not being judgment is like validating her feelings, her emotions. So I think that's a key process to empathy, validation of the frustration and emotions that emerge from all of this messy life. And if we are teaching other counselors that kind of skills, I'll also validate them by let me explain. Because Maria had made things that are kind of risky for other persons. Like I'm thinking about neglect or child maltreatment because of her 9-year-old daughter. So it might suggest some judgments, some socially accepted judgments, but in that moment, it's not our role. So it might be a kind of upset for some kind of counselors. I validate that, but I'll encourage them to monitor their inside feelings so you can stop them and being very empathic, because her suffering is real. Someone that is in that situation is very, very, very in a poor condition, and she's suffering, and that's for real. She's not an actress, so I'll try to point that.
Thank you so much. I love that point, because Jackie, you're next, because when we are talking with our counselors, especially if we're training or if we're in supervisory roles, or even just for ourselves, knowing that it's okay to have a non-empathetic response at first, right? It's okay. Whatever feelings we have are completely okay. What matters is then what we do with them. But to not beat ourselves up if our first thought isn't poor Maria, if our first thought is for the child, or if we have some kind of reaction in ourselves, that's okay. That's normal and human. And then what do we do with it, right? So then again, that's where we have our coping skills, we have our team, we have our support, we have our supervisors. But knowing that doesn't mean you're not a good counselor, it doesn't mean you're not a good person. Where if your first response is to have some negative feelings towards Maria, that's okay. That's human. And then, okay, do I take some deep breaths? Do I process with someone? What do I do to make sure? Do I drop into my empathy of, like Shigeo said, like this person is really suffering and that pain is right in front of me, and I have a chance to make a impact. And if I can impact her, then I can potentially impact the child and the whole situation. So yeah, I think that's a great point. Thank you. Jackie? Do you want to,
Yeah.
oh, you got it.
Okay, thank you, Carrie.
Thank you.
I think as a therapist, one thing that I'd make sure is that I'm very much aware that Maria will present with a lot of emotions. So what I'll try to do is that one, I will not, I'll try to understand her situation by empathizing, but I will want to move from that empathy point so that I can be able to use my skills to help her, because sometimes we are tempted to remain in those emotions with the client, and you may sort of now move from empathy to sympathy without even realizing that you've moved from empathy to sympathy, because I'm thinking, oh, she has this 9-year-old child, oh, she's very angry at her parents, you know. So that is one area that I would try to ensure that I don't move from empathy to sympathy. Another thing is that I would ensure also that it doesn't trigger emotions in me that would bring in the issue of transference. Right. That will make me not to become objective. So as much as I want to empathize, I will ensure that I'm always fully aware of what is happening to me as she's sharing her story. Because remember, we are not addressing the issue of substance, we are addressing the issue that is making her angry, whatever is making her angry, and at that particular time, it's her parents. So another skill that I've always done is that with angry clients, sometimes I've done mindfulness first to try and relax them so that they can be able now to share their story. And I've found it to work. The PMR, the progressive muscle relaxation techniques, they work very well, especially with angry clients. Thank you.
Thank you. And well, first of all, full disclosure, I teach and train on mindfulness. I'm a yoga teacher, all of that. So bonus points. I love that. Secondly, that's also really helpful for going back to immediacy too, right? Because if we do progressive relaxation or some kind of mindfulness, or even just taking a few deep breaths with the client, it doesn't only help them, it helps us as well. Because now we're more immediate, we're more in that moment because we've taken a few deep breaths, or because we've tried to relax and drop into the present. So that's great. Thank you. Yes, please.
Just to add something about how demonstrate.
Pronounce your name for me. Say your name for me.
Judith. It's difficult. Okay. Call me Judy.
You might have to like write it in an email for me how I would pronounce it, because I want to pronounce it right.
Call me Judy because it's easy. It's a Jewish name, so it's very difficult. Okay, just what about empathy? Maybe I demonstrate empathy with Maria, understanding the meaning of what she's sharing with me and what is most significant for her from her point of view. Maybe I make a statement, I use a lot of statement like saying, Maria, it must be painful to not be able to spend more time with your daughter. That's an example that we can show empathy. Also, I'm ready.
Right.
Also, we can use verbal and non-verbal in empathy. We can use verbal and non-verbal language. I can ask Maria, tell me more about the situation, the current situation. And I just write like a formula for showing empathy when we are not we have no skill about it. The basic formula for displaying empathy is you feel this, mention the name of the emotion expressed by the client, and because name the thought, experience, and behavior the client has mentioned. It's like a formula, like a guideline. Right. Also, we can also make a statement with Maria. Let me see if I have this right, or please tell me if this is accurate. It's like include disclaimer beforehand. Yeah. Or I want to make sure that I really have an understanding of what you are telling me. I am hearing that this, and this. So empathy implies a connection. It's a person, as a counselor, we are reading emotion of those that are in the vicinity. It's the ability to understand and share the feeling of another.
Thank you. Yep. Fatima?
Yes. I just want to support Jackie when she was talking about being emotional as a counselor. Empathy, most counselors get carried away, you know, and like I wrote in my submission, you see, when we are empathizing, we as counselors should be able to get back to our own world. We shouldn't get carried away, you know, with what is happening with the client. By the time we get carried away, that will amount to sympathy. But if we maintain our empathy, we create a connect between ourselves and the client, then we'll be able to show the required empathy between us and our client. We should always remember to come back to our own real world instead of getting carried away by the client's problem.
Yes, thank you for coming back to that. Veronica, go ahead. We just need to, you want me to, you got it? Okay.
All right. In my center where I work, most times the clients do not come willingly on their own. They come with parents and relatives that must have stigmatized and kind of abused them or insult them all the way. And they bring them to the hospital or the center and want to forcefully tell you all the wrongs they must have done in their lives, so that they feel that way the treatment will be more effective. And you see the clients comes in very angry, feel rejected and all that. So the first thing I do is to turn out the relatives. I will excuse them, ask them to excuse me first of all, that I want to first of all speak with my client, and that the most important person in this relationship is the client.
Yes.
And after welcoming him, I will make him feel so comfortable and acceptable. And I will try to show him that I kind of accept his point of view and not try to force my own point of view on him. Try to show that whatever he's saying is valued, whether it is right, whether it is wrong, or whether he doesn't want treatment or want treatment, that whatever he's saying is right and he has the right to be heard, then I will be able to listen to him reflectively and show him that whatever he's telling us, we value it and we'll work on it. Then from then on, you will see that the client, seeing that you have given him such audience, will begin to develop some kind of interest in telling you more about his problem and telling, because he feels that you have really actually listened to him. I think that's what had actually worked for me when it comes to warmth and empathy. Thank you.
I love the visualization of like the shift. So whoever's bringing the client in is, you know, has your attention at first, and then you're making very conscious shift to, well, this is the relationship I have to build with the client or the patient. So I love that. That's really great. Thank you. And sympathy. Let's talk about sympathy for a second before we move on. Absolutely something we all have to be mindful of and careful of, and I'm glad that you guys brought it up. You can fall into that role so easily if you're not careful. I had a lot of counselors who I supervised who I had to be really mindful with them. Are you being kind of matriarchal or sympathetic? Like, oh, you know, it's like if one of you came to me and were telling me you had a hard time with the assignment, and I was like, oh, yeah, I can understand why you had a hard time. Or if I was like, oh, poor baby, oh, you know, no, that's, you know, we get into this role where we think we know better, or we think, you know, it comes from good intentions, but it can really hurt relationships if we act like, oh, I'm so sorry for you. Oh, you know, then we kind of act unknowingly, unintentionally, like we know better, and we make them feel essentially like they don't have the tools to fix their lives, right? They don't have we hurt self-efficacy when we go into sympathy. So definitely be careful. Keep in mind, empathy is, you know, I know what it feels like to be angry. I know what it feels like to be sad or, you know, to have loss, whatever it is. Sympathy is that more, you know, oh, I'm sorry for you, rather than I can relate to what you're going, you know, I can relate to that feeling. So being careful of that line, and thank you guys for bringing that up. So now let's get more into our own personal strengths and weaknesses, because I know we have about 45 minutes and we have a great group. Everybody is good talkers, so I want to make sure we have plenty of time to do that. So I don't know, for some people, maybe it's easier to talk about what they're not as good at. For some people, it's easier to talk about what they're good at, but who would like to share your choice? Either tell us what, you could tell us both, strengths, and I don't even really like to call them weaknesses, but, you know, for sake of ease, we call them that. But, you know, what are we good at and what could we work on?
I can go. As I mentioned before, I just asked my coworkers and clients about my strengths and weaknesses. So I'm going to read what they say. Okay.
That was a brave thing to do.
That was good because I was having hard time and I have no time. I was in emergency, working in emergency. We have no time in emergencies. So my colleagues, that was I asked to 15 counselors and they wrote this one. Appropriate education and certification, experience, confidence.
Oh, Julie, when you turned, we can't hear you as well. Can you?
I can hear. Okay.
Turn more towards your.
Okay,
camera.
I had two computers with me.
That's good.
So, okay.
I understand.
Natural empathy and flexibility in worldview, cultural competence. They say strong cultural competencies and knowledge about different cultures, a strong understanding of multicultural issues in clinical practice, listen without judgment. I accept the client as is, accessible to client, let the client know that they can count with me and the treatment team, that we are here to support, I am here to support them and help them to achieve their goals. Flexible to recognize when the scene are not working and refer client to another clinician. Sense of humor.
That can be a wonderful tool. That can be a wonderful tool for sure.
Client also says that my sense of humor, compassion, that's his client's opinion. Problem solving skill to help the clients identify and make changes to negative thought or harmful behavior. Establish rapport quickly with the clients and develop a strong relationships. Recognize my own limitation. Passion to help others. They say negotiating a skill. I don't know what I mean with that, but they say that I have a strong negotiation skill. And my clients, all of them, I just send them, and I am running group session. It's 15 clients. All of them say respect and not judgment. Yes.
Lovely.
My witness, that is mine. I think that I need improvement on to conceptualize the clients in theoretical terms. It's really hard for me, like writing documentation, make case conceptualization. I need more practice in that because I tend to describe symptoms or facts instead than do it very summary. I always have confused with the clarity, have more clarity about feedback techniques, like mirroring, modeling, focusing, drawing connections, etc. And also I need improvement in paraphrasing. I am confused with that, cause me some difficulty. I can do it, but take more time, so maybe practice more.
Yeah.
Also practice a skill of rolling with resistance. I think that I need to improve more.
Yes.
Okay.
That's a good one.
Bye.
Thank you. Thank you so much. Thank you. All right. Evans, you want to go next?
Yes, let me go next. And I will talk about the weakness more than the strength. And the irony is that my weakness is also my strength. Yes, I've gotten feedback that I can empathize and I tend to understand a lot, especially clients with substance use disorders. But I've also realized that I get frustrated and very impatient when the same clients don't change as fast as I was hoping that they would.
Yeah.
And an example that happened some months back comes to mind. I have had, if you allow me a second or so, I've had this client for a long time. I've worked with the client for over 1 year, has severe substance use disorder case, but didn't have any occurring conditions. Started off with outpatient, then he got to us, was taken in for inpatient, did his time in inpatient, then came out for aftercare, and I was working with him throughout. So during aftercare, he started the patterns very clearly towards relapse. And he would throw this line to me that addiction is a relapsing brain disease. So after a while, I got very impatient. And I remember I got frustrated one time when he came to therapy, intoxicated. It was outpatient aftercare session. So I scolded him. I did not roll with resistance. We got into an argument. I got very frustrated. And that relationship ended, the session ended acrimoniously. And that was the end of the relationship. I reflected back and I realized I really had wanted him to do certain things. He was going back, and the excuse he gave, quote unquote, was addiction is a relapsing brain disease. I totally understand it is. I know the science behind that. I have seen it. But I also know that that is the same struggle that I have when they're not changing fast enough. So that is a weakness. It's both the strength and the weakness.
Okay. So I see a few people who either want to feedback on that or have their own or are ready to share. But I would. Okay. Will you share with us? I'm so afraid to butcher your name. That's why I haven't said it yet.
Hello.
Yes.
Can I come? Okay, my name is Titi Lokwe. You can call me Titi.
Okay.
That'll be fine. That'll be fine. In my profession as a counselor, one of the virtues that I think I have is patience and good listening. Well, you know, when you give the people the listening here, they will pour out their heart to you. And I have that grace that will listen attentively so that I can know where to come in. And I will look at my clients, what are the strengths they have? Because there is nobody that is totally, completely useless. No one. The mere fact that they are using substance does not make them to be useless. It's just a what? It's a disease that we can work on, and they can be useful to themselves and to society at large. So when I'm with them, this empathy thing, I can see myself, Madam Titi, is only you that can understand us. Nobody understands what we are going through. You get? So I put myself in their situation. And as well, and I do say coming for to rehab is not the most important thing, because here in Nigeria, most parents is like they are looking for a dropping grant to dump their children or their words so that they can have their peace. But I do tell them these people are not useless people. It's the way you are seeing them, and that is what you are getting back from them. So me as a counselor, I see them that what they have some strength in them, and by the time we're able to walk through and apply all the therapy for these people, you see them changing. For example, I do realize I had a client some years back. He was 19 years when he came to our facility. In fact, they brought him to our facility. But by the time we started the therapy, I can see that this guy the major thing was that he's an orphan. So he needs that care, you know. That parental guide was not there for this guy. So we started, and I think he dropped out. He was in JSH when he dropped out. So I said, what do you want to do now? Because you are the one that will determine. He said he wants to go back to school. I said, fine. Okay, let's work it out. And as we speak now, he's in the university doing well. So every child, they will ask, Madam Titi, in fact, I can never forget you in my life because you have changed my life completely. And I do tell them, that is my work, to put a smile on people's face. Thank you.
Yeah. Thank you, Titi.
You're welcome.
I want to go back. I want to go back to what Evan said for 1 second, and I do see a couple hands, so I see you, I promise. With Evans, with your example, I think, and I'm interested if other people have a different perspective, but I think empathy without boundaries is can be very damaging to us, right? And then ultimately, in this example, may be damaging to relationships with clients. So maybe that's what you have to some extent, is you have probably boundless amounts of empathy. You can empathize, but there has to be a boundary between what's their side of the street and what's your side of the street, right? So what's theirs to fix or decide if they're going to do or not, and what's yours? Does that feel like it sticks? Does that seem right?
Yeah.
It's hard.
Yeah. Makes a lot of sense. I mean, it's as you say, it's hard, especially with this type of clients. And there's the thin line between condoning and condemning.
Right.
Yeah, that's always the thin line. How much should I condone? I don't want to condemn you, but at the same time, I shouldn't condone.
Well, and I think that's where the boundary comes in, where you can say, you know, you have to make decisions for yourself, that you have full self-will and willpower to make your own decisions. Here's my concerns, keeping those as separate things, right? So, but when we have big hearts and we care about our clients, but the problem is when we get like that emotional involvement of, don't do it, don't do, you know, whatever. And it's easy to do, but, you know, a lot of what I teach and train on is self-care. And for self-care, you have to have that boundary of, I care about you, I want you to be successful, but I'm going to step back because you have a life to live and I have a life to live, and they're not the same. And sometimes we need that reminder.
Carrie?
Yes.
Can I say something here? I agree with you. Empathy without boundaries can be damaging to us. But sometimes it's really, really difficult. Because don't forget that at the point, these clients we are investing in them. You come to work every day. You spend a lot of time and energy on them. So, you know, I can relate with Evans because I've had a lot of situations like that too. You basically work from Monday to Saturday, Sunday sometimes, and you are on these people's case. So sometimes this boundary you talk about is really quite difficult to draw, because at a point you are spending a lot of time on these clients, even more than your own home. So when at the end of the day it doesn't work out well, it can be really, really difficult, and you feel as if you wasted your time. You basically, it's like, I don't know, losing a lot of money. You can be traumatized because you spend a lot of time, energy, and sometimes even your own personal resources just to make sure it works out well. So if it doesn't work out well, you of course, you know the theory, you're supposed to put boundaries and all that, but it can really be painful sometimes.
Yeah.
Of course. Okay, Fatima, you had something you want to share? You can tell us about your strengths and weaknesses?
Yes. Like, I want to say that I have a lot of weaknesses too. After all, we are all humans. In counseling, sometimes it's really frustrating for me when a client is not forthcoming, when the client is silent. Sometimes you have some clients, when they come to you, you are asking questions, you are welcoming, and the client is just quiet. The client is not saying anything.
I saw that in your notes. I made a note actually of the difficulty when it's uncomfortable. I mean, when it's silence, right?
Yeah, so I don't really like when a client comes to me. The silence kills me. I want to like say something. What is on your mind? But the client is keeping quiet, and at the end of the day said, I want to go. I say, okay, can we reschedule maybe next week? What time? But you start feeling as a counselor that little time is a bit wasted because you couldn't achieve anything.
So I'm really glad you brought this up. It's funny because I teach at the university and I'll ask a question And if no one answers, I'll just wait. And I'm like, I've been a counselor for a long time, so I can handle silence. You guys can, you know, take as long as you need. But yeah, sometimes it's really uncomfortable. One thing I want to just say, because I've heard it twice now, is I don't think we ever waste our time. I don't think anything we do ever wastes our time or the other person's time. I think if you sit with someone, even in an uncomfortable silence, but you're not judging them, you have love in your heart, you have empathy, you know, you're willing to talk to them, or in Evan's case, you've put a lot of time. I think we always plant seeds. Maybe that's just how what I have to think so I can keep doing the work, but you know, I think that's important. But also, Shigeo, do you have a comment about the silence?
Well, not really about the silence, but in the weakness.
Okay, hold on. Let me come back to you then. So regarding the silence, I think that it's really important I'm glad that you're aware of it, because I think it's something we have to get comfortable with. We have to get to a point where we can be with someone who doesn't want to share and say something like, you know what, we're going to sit together for 45 minutes. You can either use this time to talk, it's yours, or we can sit quietly, and that's okay too, you know, and really mean it. And maybe you take that time in your head to plan what you're going to make for dinner that night. You know, you're sitting there quietly, completely available to them if they want it. But I think, because one of the things that's a gift to people, if they don't want to share, is that you're not asking them to be anything but where they are emotionally in that moment. And I know it's hard, but sometimes that's a gift that we give them, you know, is that we say, you know, Fatima, we're sitting together for the next hour, whether, you know, clearly you don't really want to be here, that's okay. You know, you can even say, like, you know, I'm on the clock either way, so I'm going to sit here with you, and I hope that you'll share, because that's my job and I'm really here and I care about you. But if you don't want to, okay. You could even make that joke, you know, well, I guess I'll plan out my groceries for the week. You let me know if you want to talk, you know. And you're just there, real present with them, quietly, just being, you know, because remember, like, a lot of people we work with are just like Evan, the example that Veronica did of, like, you know, the parents are bringing them in, or the partner's bringing them in, or a lot of people are telling them what to do. We don't have to be those people too, you know? It's hard, I know, but it's, I don't know about you, but my favorite thing about working in this field is how much I get to grow. So if it's hard, to me, it's like really worth trying to work on, you know? Thank you. Shigeo, you want to talk?
Yeah, well.
Why only weaknesses? You have nothing good to say about yourself?
No, yes, but I like to share the weaknesses. Particularly, I don't know if just me, but when I'm treating a client or a patient who is in a mild state of substance use disorder, and it's keeping up, you know, I mean.
In a what state? I didn't catch it.
Mild and a small stage. Yeah. For example, maybe a teenage boy, he's just using marijuana, and around like the next session, he tried methamphetamine, and it's like, oh no, and okay, I try, and the next session he's trying another thing, another kind of drug. So that kind of situation is frustrating for me. I try to not acting out that frustration, but I know it feels inside. That's one. Sometimes I tend to be more, I want to go to my speed and not to the speed of the client.
Oh yeah.
Because I'm seeing that it's not, I mean, the thing is like, I know he's falling, and I want to, if we don't stop that falling, you're going to, I don't know where you're going to be the next month. So sometimes that kind of frustration may make an interference in the relation. And
but let me ask you, do you ever say that to them? Do you ever say to them, you know, I've seen, you know, I've done this a while, and I'm seeing a pattern that concerns me because, you know, last week you had only used marijuana, but now you've tried this. And honestly, I'm a little scared.
I didn't try it that way, but I'm going to incorporate that skill to my
Because here's why I find that to be a nice thing to do. First of all, you're showing them concern, but you're saying it in a way that's not like, we're not being parental, we're not being judgy, right? But you also get to say it can help you because you get to say your feelings. Like, I think we try to be so professional and have such good boundaries that we don't say, we can make ourselves almost not as human as we should be, you know? So like, if you guys were all here and no one was talking, like, I think it would be fair for me to say, wow, well, this makes me a little nervous. I was hoping you guys would participate, and this is our first time, you know, I mean, and that would humanize me. So I think sometimes we're nervous to do that. But if you do it the right way, it's fine, you know? I mean, it shows, again, that empathy and genuineness, and to just say, you know, again, I work more with my kids than I do with clients at this point. So I use that example, but I'll say that to my kids, you know, if they say something and I feel a big reaction in me, before I say something, I'll say, you know, okay, that just made me feel kind of anxious, or that made mom feel bad. So I'm going to wait a second before I say anything, or, you know, I don't think my response would be great right now, you know, or something like that. And I think that's okay too. You know, I think it's fine to say, I'm really concerned with how this is going. You know, I've seen this happen before, and you can use it, you know, I guess that's why I love motivational enhancement therapy so much, because you can use it like that. Like, so last time you came, your substance use was kind of mild, but now you're getting, it seems like more. Would you like me to tell you what I've seen, what the end of that story might be? You know, so that's another nice way to do it. But I don't think any of us should be nervous to say, that concerns me, or I'm worried about you.
Okay, thanks.
Yeah, thank you. That was a really great, I appreciate you sharing that. Who else wanted to talk about their strengths or weaknesses? Veronica? We'll go Veronica, and then we'll go Ulia.
All right. I actually want to talk about what I struggle with rather than strength.
I am sensing a trend. Well, how about we say this? We'll say a blanket statement. Because you're given your years of experience and your recommendation to be here and things like that, I'm quite sure you all have amazing strengths. We just want to get help from each other with our weaknesses, right?
Yeah.
Okay, fair enough, fair enough.
Yeah, what I actually struggle with most times is when we talk about immediacy, that's to focus on what is the actual client's problem. And the center I work with, we have our own protocol to follow when the client comes in. And you also have to align with such protocol. So when a client comes in, he has what is most important to him. But what I have to do as a supervisor or a counselor at that point, I have to follow the protocol of my center. By the time we are getting to what is most important to the client, the rehabilitation period is almost off. So
can I just tell you thank you? Can I just pause you and say thank you? Because I've brought this up before, and I think, again, I want this to be a very real course for you all. I want you to talk about what's really happening, because that was my experience too. You know, you have grants, or you have protocols, or you have requirements, whatever it is, and yeah, they tell you what you have to put on that treatment plan, or what, you know, so yeah, let's talk about the reality of it. I want to be present for you and listen to what you have to say, but on the other hand, I know that I have to do all this paperwork, or to have this treatment plan, or that I'm going to get in trouble if I don't do X, Y, and Z, right? Okay. So thank you for keeping it real, Veronica.
Yeah. All right. So presently, what I've actually done for my center for us to be able to attend to clients' immediate needs is for us to be able to include the clients and the relative in the treatment plan, and ask the client, what do you want? What is most important to you in this treatment? And we'll prioritize it and begin to work from the order of priority. And that
Yes.
actually has started working for us now.
That's
Although
great.
we are still working on it, but we have not
Yeah.
gotten there. Yeah, thank you.
That's
what
great.
yeah.
And you could probably, if you haven't already, also add in what I was saying earlier, which is like, you know, say you and I were in session, Veronica, what you
Yeah.
want to work on is incredibly important to me. I want you
Yeah.
to know that we're going to prioritize that. Also, my bosses make me do these 3 other things on the treatment plan. So just so you know, and I think that's okay. I mean, that's been very successful with me. And it partners us too,
Yeah.
Yeah. Thank you.
Yeah.
Okay, Olia, your turn. Do you have something positive to say about yourself?
I have a positive thing
Okay.
about me and a weakness too. Well, more than one weakness, but I'm gonna talk just about one weakness.
Okay.
About the strengths, I think I'm naturally a warm and empathetic person, but I think that something that happened when I was a counselor, when I was working in a mental health care center, I lived a special experience that I've never forgotten. I think that experience helped me to be more empathetic. I like to share this experience with you. I was working in this center, and I usually review the fields of the people before I attended. And I recognized, so I thought, I think I know this name, but I wasn't really sure. But the name, but I was, I'm sorry. It happens about 8 years ago, but the truth is I didn't recognize the name, and suddenly I saw a former coworker crossing my office door. I was really surprised. I was working in drug treatment, she was really surprised too. I also saw in her face something that I interpreted as shame. It was really uncomfortable for us, and I don't know if I was creative or I was spontaneous, and I jumped off my desk and I hugged her.
Okay.
Yeah, I welcomed her and invited her to take seat. It was a difficult moment at first. I didn't know how to act. I asked her if she was comfortable having the first interview with me, or if she preferred to make an appointment with another professional. She decided to talk with me for a while. After talking a little about her drug problem, I told her what I really felt. And I remember that I said her, today you are on that side on the desk.
Right.
Tomorrow it could be me. We all need support sometimes, and I really appreciate your bravery now. After that session, we agreed that the most appropriate things could be make an appointment with another social worker and continue her treatment process, and we did so. But in this experience showed me that we really can be on the other side. We never know. We all are. We share the fragility, the human fragility. And I think that it's true. Now I'm here, and I have the possibility to help you, to accompany you. The work is yours, but you never know.
Oh.
Yeah.
Thank you. I'm really glad you shared that story with us, Julia. One thing I really love, and you'll see this in a lot of what I work on with you guys, is the directness that you used there, asking her if she was comfortable. Obviously, ultimately, it was not a, good match to be her counselor when you have that background, but also, letting her know, well, this, that could be me. you know, and that's true for all of us. So I think it lets her, you know, it's letting people know that we're not better, right? We're not above, and that kind of goes to that sympathy and empathy part as well. So thank you. I really appreciate that.
And,
So,
and a little about the weakness.
Yes.
I have trouble sometimes working with clients who arrive to the appointment in an aggressive way.
Yes.
Sometimes there are clients that who get referred by family courts or law, used to arrive at the treatment center without intrinsically motivation, but that's not the problem. We know that people
the aggressiveness or the anger.
It's aggressive, and it was really difficult to deal with this attitude to me, and I think I learned that a little strategy, and I told when I am in this situation, I told to the client, listen, in this situation we are both obliged to work together by order to the family court. What if we take this like an opportunity, and what do you think if we talk about something that is really important to you and what I could support with you? You are the principal actor in this interview, and I'm here to hear you. But
that's exactly what I would recommend. I have nothing to add to how you handled that with the client. That's excellent. The only suggestion I would have, or the only comment is, yes, sometimes we have certain types of clients, how they present, that bother us, and I'm similar. If they're very angry and aggressive, that can be difficult for me. Sometimes it's good, since we're talking about self-reflection and introspection, to try to think about, why is that? You know, is it a trigger for you from your life? Was there, you know, did you have a parent who was angry, or did you know? So sometimes it's good if we do that work in ourselves to realize. And then also it helps me to come back to, when people present really angry and aggressively, again, like we said earlier, remembering that anger is a secondary emotion, right? So that's their armor. They're showing you their armor rather than showing you their heart. And so you want to get to the point where they can show you, you know what, I'm really scared, or I'm in a lot of pain. But if we respond to their aggressiveness with aggressiveness because we're triggered, we're never going to get there, right? But I mean, it happens, you know, you may never do that. I've done it before. So, okay. Well, thank you so much. You guys have been amazing with how much you're sharing and with your vulnerability and the examples, and just, I'm really impressed and so excited about this group. So thank you. Let's take a minute to look at what we have for our next session and to schedule our next time, because we're getting towards the end. And for some of you, I know it's late. And does June 12th at the same time work for everyone? Or maybe I should say, is there someone it does not work for? Would be the better.
I think June 12th is perfect for me.
Thank you, Ameza. Okay. So what I will do between now and then is I will send you the link for our next session. If I can figure it out, this part's new for me, I'll send you a recording of today so you can review that should you be interested in doing that. And I'll remind you, I'll just do a quick summary of what you'll be doing between now and then for your assignments. So we're skill module 2, we're going to look at key elements of a therapeutic helping relationship. So again, there's going to be some similarities to what we talked about today, but we're going to shift from just our skills to our relationship with the client. So there will be some similar things, but I think you guys will find it interesting. I know some of you mentioned self-disclosure, so we'll talk about that, counter-transference, transference, so there'll be a lot of things that experiences I'm sure you'll be able to share with the group as well. So you'll get that email from me. Does anyone have any comments or questions? Oh, you're also going to get a quick survey. It's probably only going to be like 5 questions that just says things like, was it easy to log into the forum, the ISA? Did you learn something? Is there something else you would like to learn, or how it could be better? Try to make it really short and sweet. So if you guys can fill that out for us, we appreciate it. Okay. Thanks again for all of your feedback.
Thank you.
And for being so participatory. I appreciate you all, and I'm excited to continue on the journey with you in 2 weeks.
Thank you.
Thank you.
Thank you,
Bye.
Gary. Thank you all.
Bye.
Bye-bye.
Bye.
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 Bye.